Well, beginning when I was a resident 30 years ago on rehabilitation, I found that patients couldn't know where their joints were in space. This is true for both multiple sclerosis and stroke. And so I developed sensory feedback augmentation for them from my bioengineering training. I saw that therapists and patients could use this because a lot of times they don't know about physical sensation and could benefit from more therapeutic use or therapeutic teaching of the same. The WearSense company is based on the great growth of wearable sensor technology really in the past decade that includes both the micro-miniaturization of electronics, the transmission of Bluetooth, and the use of ubiquitous smart devices, as well as by web remote monitoring. It's created the growth of numerous companies and numerous new products in the wearable sensor marketplace. The sensor is small, rugged, accurate, unobtrusive, water resistant. It's almost like clothing, and that's why it's a wearable sensor. The capabilities of this wearable sensor are to take a physical quantity like force or pressure and create a dose that can be transmitted back to the patient. For instance, too little of this dose is not effective. Too much, it could be toxic. The ability to measure pressure really will improve outcomes, quality of care, and promote and improve people's lives. The sensors work by monitoring pressure underneath garments, and I use a special pressure sensor that's been developed over years and patented to do this. This then goes to a device smaller than a quarter. The sensor transmits via Bluetooth to a smart device or the web. They interface with smart devices by using a novel display. It's really an analog pressure gauge that everyone is familiar with. And with that, it's easy enough used for training. That's for immediate use. For long term, you could have something that looks like a Fitbit and that can show people their progress over time. The WearSense family of sensors can be used by therapists, doctors, as well as consumers who have chronic medical conditions. Improve, get better training. It can use it in preventing wounds, either diabetic or venous stasis, or lymphedema, reducing edema, or through fracture healing, as well as provide documentation for third-party payers to know that there's progress being made. The WearSense family of products can be used for any application where force or pressure needs to be monitored.
I'm the co-founder of WearSense, and my main role there is to really find investors for ongoing development, and also to coordinate all the different disciplines, from hardware, software, and productization, and taking the whole idea and concept and turning that into a manufacturable product. I also originally developed the software for both Apple and Android mobile devices, as well as the firmware that runs in the electronic control module. One of the exciting and pleasurable things in the whole WearSense development process is, of course, working with Dr. Goldman, who's been working on this technology for the last 20 years or so. And he really took a concept and an idea, and in his basement, he sort of formulated the first prototype. And then the rest of the team came along and really just expanded on that and sort of formalized it into a marketable product. But Dr. Goldman has done an incredible job. Has had a number of patents published over the last 10, 15 years, and in fact, some of those patents are in fact still applicable to the WearSense product line. So without him, we wouldn't be here today. The reason why I'm excited about the WearSense product is because it's really a breakthrough in its size and its flexibility to really measure accurately something that couldn't be measured before. And that will give the consumer a lot more confidence in being treated well and hopefully healing well. Yeah, another exciting aspect of the WearSense product technology is the fact that you can remotely monitor the device. So, this is a great help for clinicians, for technicians, for doctors, etc., to really know whether the patient is actually wearing the sensor continuously, etc. But not only for that, I think you can keep a record of what the pressure was when the patient was sleeping or walking or standing or sitting, etc. So there's a whole history that you can later on retrieve, both for the sake of the patient and for the sake of the doctor, and really analyze, what happened, in this particular situation that you're treating. There are a number of ways that a WearSense product and the technology can actually be licensed. One of the ways would be via a royalty, so people could just take the concept and incorporate the technology into their own product line, or you could actually take the entire product and incorporate that into the third-party product line. So we are pretty flexible on the whole licensing concept, and I think the sky's the limit. We recently closed our first funding round, which was instrumental in allowing us to accelerate our development of our second generation product, which is now available. So that's pretty exciting. This new product is much more flexible, much more accurate, and it should have incredible results from a market point of view.
As director of engineering, I felt that I could help Dr. Goldman achieve his goals by thinking about the major challenges that we face with the next generation. The four fundamental things that we thought we needed to focus the most attention on was size, power, functionality, and also cost. The size had to be able to fit in a protection garment, and it also had to be comfortable for the patient to wear. In fact, we were hoping that the patient wouldn't even know that he was wearing it. And what that meant that we needed something about the size of a postage stamp or a quarter. Yeah, next on our list was power consumption. And the unit had to last between charges longer than a few hours or a few days, but we were anticipating weeks. So this is important for two reasons: for convenience and patient usability. And that meant that we needed to use the latest technology that conserves power in every possible way. And we also needed to think about hardware and software and how we could get the most from those two utilities to make the power as low as possible. And I think we came up with some pretty innovative ideas in those areas. Next was performance or functionality, and the data had to be accurate, reliable, and in a format that both the clinician and also the patient could readily use. And this meant that capturing the data and displaying it remotely on a mobile device by Bluetooth, and also having this data available for clinical analysis on the cloud. And all these requirements then met a very low power dual-core ARM processor. And then finally, there was cost. The product had to be available or affordable to anybody that needed that product. And I believe with the WearSense family of products, we achieved all four of those goals. I'm proud of all the aspects of the product, but in particular, it would be size and expandability. This is a very small size product with capabilities of moving data, capturing data, and analyzing data. And along with that, though, this product can be expanded to other industries, other markets, and all this with very little additional effort or resources. When we look toward the future, we're talking about reducing the size of the product, and in particular, we want to reduce power consumption. If the power consumption is reduced, this gives the user just more flexibility to be able to use the device without worrying about the details and the technical aspects of it. I'm very excited to be with the group that I'm working with. They have a lot of talent and they're dedicated people, and they kind of bring out the best in me.
My name is Jesper Sten Møller. I'm a first-round investor and software architect and developer at WearSense. I was attracted to investing in a company that's going to make a positive change in people's lives, and also an investment where I can contribute directly because of my software background. My background is in web systems and administrative systems and government and private sector. And also my background is that I'm based in Europe, which the rest of the WearSense team isn't. My involvement in the WearSense development is into the firmware for the new generation hardware, and also into an Android app for supporting that, or as the companion device for the center. Finally, I'm also doing the remote monitoring. There's a lot of potential in the product, both in the lymphedema space, but also in other applications where a center of this size and accuracy can make a big improvement in people's treatment.